Hi, I'm Josh Isman, founder of Psylo. Mental illness is the health crisis of our time. We know that COVID has had a compounding effect on this problem, and we know the current solutions are completely inadequate. 1 in 8 Aussies take antidepressants, which are only slightly more effective than a placebo and come with heaps of side effects. Pharma is underinvesting in alternatives. There's been a reported 70% decrease in clinical research programs in this area over the last decade, but that's beginning to change. 50 years ago, a significant body of research into psychedelic assisted therapy was buried with the war on drugs, but is now seeing a resurgence. Psilocybin, the active molecule in magic mushrooms, was designated a breakthrough therapy by the FDA and is poised to serve as a starting point for an entirely new class of mental illness medications. Psylo is Australia's first psychedelic biotech company. We're formulating derivative molecules of psychedelics. Our initial target is to produce a shorter acting psilocybin to serve as an improved treatment for anxiety and depression. I'm a repeat founder, entrepreneur, and biotech investor. My co-founder Sam is a leading medicinal chemist with a proven track record in molecular discovery. Together, we've raised an oversubscribed pre-seed round of local and international strategic investors, and we've begun synthesis and screening on several new libraries of novel molecules. We've launched a virtual drug company on the bleeding edge of psychedelic science, but we're just getting started. Learn more about us at psylo.bio, and thank you.
Thank you so much, Josh. Amazing stuff. Psychedelic medicine, such an exciting area, such a hot emerging area. And you're doing it here in Australia. So can you just tell us why Australia is such a good place to launch a psychedelic startup?
Thanks, Petra. Australian biotech is having a bit of a moment right now, as you know, which is no surprise. We have top-tier academic institutions and one of the most generous R&D tax credit schemes in the world. But I was actually surprised to find that research into psychedelics is actually easier to do from Australia than it is from the US, for example. We assume our conservative drug policy would make Sam and my jobs more difficult, but the opposite is actually true.
And it's really rare to find a startup biotech with two founders that are complementing each other as well as you and Sam do. We've got deep science expertise combined with commercial experience. I'm really curious. Tell us about how you met, because this really is a match made in heaven, and one of the reasons I'm so excited about you guys. So tell us, how did you meet?
Yeah, so I had an exit a few years ago, and a close mentor of mine suggested networking around the unis to find the next big thing. And that actually ended up being really fantastic advice. So I launched my search into psychedelic science from the Sydney Knowledge Hub at Sydney Uni, and I met Sam from there. He's quite modest, but he's actually a world-renowned scientist with biotech startup creds from his time at Stanford. Sam, do you want to jump in here and get some airplay?
Yeah, sure. It was really fortuitous for Josh and I to have met when we did, because I've actually been thinking about starting a psychedelic biotech myself for a little while. I've had a really great career in academia, but ultimately, the private sector is the way to make things happen quickly, and this is an area that really urgently needs our attention. We've been able to get started really quickly because a lot of the hurdles that historically existed for drug discovery startups have been equalized with tech. So we don't need to build a massive infrastructure to initiate our research. Like with software, we can quickly ramp up using a virtual model for our R&D.
And depression is a huge issue today. And Sam, I understand that there's a personal motivation behind you starting Psylo as well. Tell us a little bit about that.
Yeah, so in addition to a long-running interest in the therapeutic potential of psychedelics, I've got a number of friends who've been deeply affected by mental illness, and I lost a close friend earlier this year to depression. So this is not something that affects other people. As someone who designs medicines for a living, I feel a personal responsibility to make a contribution to this field, and we're going to need a lot of help. So for all the medicinal chemists out there who are watching, or anyone who knows medicinal chemists, please get in touch. We're building a team and ramping up our efforts, so come and join us.